So, hello, thank you for coming.
Hi, sure. Thank you for being here.
I'm going to get right into this. This is a lecture on the #1 cause of death in our society. Close with cancer. They kind of nip and tuck for the leading cause of death in American society. So the question is, who do you think is better at treating coronary artery disease? These guys doing this, or this lady providing good food in this setting? These guys, you'll learn later on as we progress, are providing symptom relief. They're bypassing the blockage. It does nothing to address the cause of coronary artery disease. Eating a whole food, low-fat, plant-based diet, reversing insulin resistance, necessarily lowering cholesterol, will cause coronary artery disease to reverse. Kind of makes you crazy when you think about it. And it brings us back to this original truth that we've all heard: let food be thy medicine, and let thy medicine be food. This was 2,000 years ago. So the human heart, I always like to remind people that they live in a body that is a miraculous healing machine. Your body is phenomenal. Often we are led to believe that we need to stay close to the medical and to the doctor to stay healthy, get checked out and vaccinated, etc. The truth is your body's a powerful healing machine. It's just not necessarily well suited for the 20th and 21st century. Human heart beats 80 to 100,000 times a day, and during a typical day pumps 2,000 gallons of blood. That means over lifetimes it beats 2 to 3 billion times, pumping up to 65 million gallons of blood. Never stops. This is the human heart. You've all seen this. These are the coronary arteries that get so easily blocked up. This is the big left anterior descending. This is the left ventricle that pumps blood through the aorta to the heart. This is the bringing blood to the right side of the heart where it's pumped to the lungs. If you took all the blood vessels out of an average child and laid them in one line, the line would be over 60,000 miles long. Take all of the arteries and veins out of an adult, it would be 100,000 miles long. The circumference of the earth is about 25,000 miles. So it's a vast internal network. You can see here the heart pumping blood through the arteries. The heart is a symbol representing many things in our society: spirituality, emotions, love. The word heart continues to be used poetically to refer to the soul. The heart symbols represent love, as you know. The heart also produces hormones. It was classified as an endocrine gland in 1983 after they discovered atrial natriuretic factor, ANF. It's used to diagnose congestive heart failure. It exerts its effect on blood vessels, the kidneys, and the adrenal glands. It has to do with regulating water, sodium, maintaining the balance in the circulatory system. The heart also produces neurotransmitters like the brain. It has a cell type known as intrinsic cardiac adrenergic cells. Adrenergic meaning sympathetic nervous system. It'll speed the heart up under times of need, releasing catecholamines. As you know, catecholamines are the activate the body into a sympathetic stress fight or flight response. Heart also makes oxytocin. Oxytocin is a powerful hormone that we think of in childbirth, pitocin, to bring on labor. But that's just one part of its function. It's believed to be the hormone that binds a mother to the child in all species. Concentrations of oxytocin in the heart are as high as those found in the brain. And the heart has a nervous system of its own. The intrinsic cardiac nervous system, or heart brain, is made up of complex ganglia, receiving information from the body and putting out regulatory information through sympathetic and parasympathetic neuron. These are some there we go. Whoops. This is getting really... This is a graphic of the brain in the heart and how it works. So this is the heart down here, and it has a complex relationship to the brain. As you know, the sympathetic nervous system is our stress fight or flight system. It does everything to speed up the heart so you can escape danger. The parasympathetic nervous system is the opposite system. It can be called the healing system. Parasympathetic nervous system governs long-term projects like hormone production, digestion, and immunity, whereas the sympathetic nervous system solely allows us to escape danger. In 2007, the leading cause of death in this country was heart disease, followed closely by cancer, and then further down are other chronic illnesses. The types of heart disease are coronary artery disease, where the coronary arteries plug up with cholesterol. It's called atherosclerosis. That's the most common. That can progress and produce a heart attack, although 50% of heart attacks occur in people who don't have those risk factors, and you can have a heart attack with no coronary blockage. It's not typical, though. Other forms of heart anginas, when you have chest pain because you're not getting enough blood flow to the heart, not enough oxygen. When people are typically, when they exercise a little more, run for the airplane, run up a flight of steps, and they get chest pain, it's exercise-related chest pain. It's called angina. So coronary artery disease is by far the biggest cause of heart disease, followed by heart attack, angina, heart failure, stroke, and then other types. Heart disease caused 26% of deaths. It's the leading cause of death for both men and women. And once again, coronary artery disease is the most common type. So it's important to understand this issue and how we can not only treat it, but prevent it. 785,000 Americans have a heart attack each year. That's a lot of people. Every 34 seconds, someone has a heart attack, and every 60 seconds, someone dies from a heart disease-related event. In 2010, heart disease will cost the United States $316 billion, and most of that is for treatment that's mostly symptomatic, does not address the cause of the disease. So, coronary artery disease. That's where the coronary artery gradually blocks up. These are coronary arteries. They supply blood to the heart itself. If this coronary artery actually blocks and then a clot forms, this is a blood clot, then downstream, this artery comes out of right here. It goes down and feeds the heart itself with blood. If there's a blockage here based on a clot in a narrowed area, then you get dying heart tissue, which is called a heart attack or myocardial infarction. These are the risk factors for coronary artery disease: high cholesterol, high blood pressure, diabetes, cigarette smoking, obesity, poor diet, physical activity, and alcohol use. Most people have at least one of these. So, how do we treat coronary artery disease in our society? It's high-tech medicine. This can be the main tremendous source of income for the average community hospital. They do coronary angioplasties and stents, where the doctor inflates a small balloon at the end of a catheter and it opens up an area in a coronary artery that has been gradually reduced over the years with cholesterol buildup. You can also put a wire tube in there called a stent to permanently open it up. Sometimes the stent has a drug on it. And then finally, coronary artery bypass surgery. These are the conventional treatments: angioplasty, stents, and bypass. This was a study done by a doctor at Duke University. We quote, "We have found in a long-term analysis that stents do not provide a significant early and sustained reduction in the need for subsequent procedures to reopen the treated artery. We have also found that stents do not have any influence on long-term survival." This was a study published in the New England Journal of Medicine in 2007 on 2,287 patients with stable coronary artery disease. That means that they had significant coronary blockage, but they were stable because they weren't having chest pain. They were, unstable coronary artery disease is when somebody goes to the ER because they have chest pain or shortness of breath. So they took these people, half of these people were given stents together with drugs and lifestyle modification. The other half only got the drugs with diet and exercise. After 5 years, there were no statistical difference between the two groups in regard to deaths, heart attacks, or strokes. There was presumably a big difference in price, as each stent costs approximately $15,000. So there's basically no difference if you manage a cardiac patient medically, which means you give them diet, drug therapy, which is mainly statin drugs and blood pressure pills, along with diet and exercise, or you give them a stent. People thought this research would reduce the number of stents, but it didn't. Maybe it did for... They expected the stents to drop dramatically after this was published. It did for a while, but stent placement is now back to historic highs, nearly 1 million annually. If cardiologists follow these guidelines, trying medical therapy first with stable chest pain, they would put in 1/3 fewer stents, saving $5 billion each year. But cardiologists are trained to do stents. That's how they make money, and that's what they like to do. This was a study in 2001. The direct and indirect cost of cardiovascular disease nationally is $368 billion. In 2001, an estimated 1 million angioplasties procedures were performed in 2001, and 475,000 stent procedures. From 1987 to 2001, the number of these procedures increased 266%. In addition, 500,000 1,000 bypass procedures were performed on 305,000 patients. The average charge for these for the percutaneous, angioplasty was $28,000 and $60,000 for coronary artery bypass procedure. Both of these procedures are symptom relieving. And they can be significant. If somebody does have I don't want to mislead here, if somebody does have a lot of chest pain, opening up, improving blood flow can make them feel better, but it does nothing to reverse the cause of their disease. The bypass can temporarily alleviate chest pain, but does not increase longevity. The vast majority of heart attacks do not originate with obstructions at narrow arteries. Coronary bypass also creates in 51% of patients brain damage and loss of mental function. Cognitive decline from mini strokes, hypoxia, and other cardiac arrhythmias and fevers. So we come back to the basic issue in our society is that doctors and hospitals make money off of treating disease. They don't make any money off of preventing disease. This is a book that goes into this extensively. This is the reason for the healthcare crisis in this country, because conventional medical care is focused on treating disease using these typical high-tech procedures, and very little effort goes into making people healthy and reversing their disease. Therefore, it's not due to insurance issues, or it's simply because the Western model for treating disease does not reverse it or cure it. It just continually provides expensive care, and the disease goes on and on. Doctors no longer heal diseases, they manage diseases. Statins have become one of the most widely prescribed medications for the so-called prevention of cardiovascular disease. This was a study by the Department of Family Medicine, University of Michigan. For secondary prevention patients, or people who have coronary artery disease, there is no controversy. Statins have been shown to be an effective treatment. The question raised is about the use of statin in someone who has not been diagnosed and whether they're worth it. They give statin drugs to everybody thinking it's going to prevent coronary artery disease, and that's the problem. This was a meta-analysis of 11 trials of statins. 65,000 people with no history of heart problems, but with traditional risk factors. Treatment with cholesterol-lowering medications did not significantly lower the risk of death from any cause over an average of 4 years. There's been a lot of studies, and this is controversial. Published in 1997, fully half of all patients with coronary artery disease do not have any of the established risk factors. This was a study of comparing C-reactive protein and LDL cholesterol. This data suggested that C-reactive protein is a stronger predictor of cardiovascular events than so-called bad cholesterol. And as you know, C-reactive protein is a marker for inflammation. When you have a high C-reactive protein, the blood becomes viscous. When the blood is viscous or thick, it's prone to clotting. This was a high C-reactive protein in the future and the risk of future heart attack in healthy men. You can see the risk of heart attack. The higher the C-reactive protein, straight up goes the risk for heart attack. It's very important to know what your C-reactive protein is and bring it down. In women, the same thing occurs. The risk for heart disease, the higher the C-reactive protein, the greater the risk. And this was C-reactive protein in both of these. So, inflammation is an important issue. Inflammation has to do with this molecule called nuclear factor kappa beta. It's involved in inflammation in all these diseases, from cancer and heart disease, diabetes, a host of diseases, Crohn's disease, neurodegenerative disease, osteoporosis, Alzheimer's, atherosclerosis. They have to do with inflammation. Inflammation is a key factor in chronic illness. The sources of inflammation are alcohol, just living in our world and exposing to sunlight, environmental pollutants, food factors like grilled, fried red meat, bacterial infections like Helicobacter, viruses like EBV or infectious mononucleosis, hepatitis viruses, cigarette smoke, and then stress. This was a study where they took one egg McMuffin, egg sausage McMuffin, and 2 hash browns, and they measured the increase in NF-kappa beta over the next 2 hours, showing that NF-kappa beta, the key marker in inflammation, rose from 100 to 250 units, over doubled. Infection is another source of inflammation, either by bacteria or viruses. All atherosclerotic plaque that is taken from patients having bypass procedures, much of it has chlamydia pneumoniae. It's a atypical organism that lives inside cells. There are people who postulate that and it's been brought up frequently over the years, that maybe we could prevent heart disease if we gave antibiotics. Problem is, these organisms are not bacteria floating in the blood. They're living inside the cells and they don't respond to antibiotics. So, what is the real cause of coronary artery disease? There's inflammation, there are lipids, and may or may not. What is the key issue? And now it's generally felt that endothelial dysfunction, which is a hard issue to define. The endothelium is the lining of the arteries, and it's a very biologically active, single-celled layer that produces a lot of biologically active compounds. Maintaining the health in the endothelium is a very important issue. It's the inner layer providing a smooth protective surfaces. Endothelial cells prevent toxic blood-borne substances from penetrating into the blood vessel. It's damage to the endothelium that allows the lipids to penetrate into the blood vessel. It can also be damaged through oxidative and inflammatory changes, leading to the development of atherosclerotic plaque. This is a normal artery. You can see it's very rubbery and strong because it carries a high pressure. And then you can see how the plaque develops underneath the endothelium, so that you have a narrowed artery. This is a 50% blockage, maybe a little more. This is cholesterol, foam cells. There's chlamydia in there. If this ruptures through, it'll produce a clot and a heart attack. There's also a condition called vulnerable plaque. Many people who have heart attacks do not have arteries that are severely narrowed by atherosclerosis. It's kind of like a scab on a wound. There's no blockage, but there's a wound it's called a vulnerable or soft plaque in the coronary artery, where there's a lot of inflammation of vulnerable plaque. With a vulnerable plaque, the coronary angiogram looks normal. There's no blockage. This is how it is believed that vulnerable plaque is formed. Fat droplets are absorbed by the artery, which causes a release of cytokines that lead once again to this key issue in chronic illness called inflammation. The inflammation makes the artery wall sticky, which attracts these different types of white blood cells. They squeeze into the artery wall where macrophages come, and eventually there's a little fat-filled plaque, thin covering, which can rupture. This is an example. See, there's no blockage. The artery itself is normal. There's just soft plaque called vulnerable plaque. These are the things that contribute to endothelial dysfunction. High cholesterol, triglycerides. This is a key issue, oxidized LDL. This is very important. You can have high LDL, but if it's not oxidized, it will not cause problems. Elevated C-reactive protein, high insulin, high blood sugar, high fibrinogen is like C-reactive protein. It's a marker for thick blood. Inadequate vitamin D, hormone deficiencies, lack of CoQ10, and nitric oxide deficit. Metabolic syndrome. This is a really important issue. It's a main factor contributing to the epidemic of obesity in our society. It has to do with primarily abdominal fat, poor diet with excess fat and refined or high glycemic carbohydrates, and the buildup of fat inside fat cells, physical inactivity, certain nutrients are deficient, leading to syndrome X or insulin resistance. Insulin resistance means, I believe, the key issue is too much fat inside muscle cells, interfering with the movement of glucose into the cells, and the body responds by elevating the insulin. More insulin in the blood. Insulin is a fat storage hormone. Then people gain weight, the blood pressure goes up. The insulin receptors don't accept the insulin, and eventually, once again, nuclear factor kappa beta, inflammation, and the whole process of insulin resistance. This also comes up in the strong literature on longevity. Insulin resistance is a key issue for shortening your life. The reason we develop insulin resistance is because for our ancestors on the earth, the body fat wasn't that available. We didn't eat that much meat. Robert Leakey said that our ancestors ate a primarily chimpanzee-like vegan diet with an occasional bite of meat. So because fat is so important, fat is used in the brain, it's used in every cell wall, it's essential. The body stores it real carefully because it may not get very much of it in the natural environment of the hunter-gatherer. 40,000, 50,000 years fast forward, we're getting fat once or 2 or 3 times a day. The cells fill up with fat because it's used to storing it. And that's when we develop insulin resistance. A low-fat, plant-based diet reverses insulin resistance and also reverses coronary artery disease. Twenty to 30% of Americans are insulin resistant. Only a few will get diabetes. It's an accurate predictor of heart disease. Many of them have high blood pressure and is closely related to weight gain. This is another issue in terms of heart disease, which is vitamin D deficiency. Men with vitamin D3 levels low have 2.4 times more heart attacks. 92,000 deaths from heart attack could be prevented if men optimize their D3 levels. We believe, based on some studies, that Lipitor may reduce heart disease by 37%. Vitamin D reduces it by 142%. But vitamin D cannot be patented. You cannot make money off of vitamin D. So you hear about Lipitor on the nightly news, and nobody hears about vitamin D. There's also, it's quite well known that your cholesterol can go up if you have low thyroid. If you take out the thyroid glands from bunny rabbits, they get atherosclerosis, accelerated atherosclerosis. Rhoda Barnes he was an expert on the thyroid. He believed between 1930 and 1970, huge intake of heart attacks. He thought that low thyroid was the main cause of this in his research. Mark Houston was a lipidologist paid by the big pharma to represent statin drugs. He has some newer tests that I'm not going to get into tonight. He says that the statin drugs decrease the conversion of T4 to T3. So people taking statin drugs can actually become hypothyroid, but their blood tests will be normal. So these are people that are fatigued, they gain weight easily, cold hands, cold feet, symptoms of low thyroid, but their blood tests are normal and they're not given thyroid medication. When you take statin drugs, you also interfere with the production of CoQ10. This is a lipid panel, cholesterol, triglycerides, HDL, LDL. This is now considered to be an obsolete test because it misses lots. This is an old generation test. The new test is called the lipoprotein particle panel. 50% of those who have suffered heart attacks had normal cholesterol, less than 200. The issue is, if you have a cholesterol of 180, are the size of the cholesterol particles large or are they small? Small particles penetrate through the endothelium and increase risk. This is an example of that. Each of these people has a cholesterol of 125. Low risk is large size particle. And then you can have the same 125 but small particles having high risk. So it's the particle number that's the key thing, not the total cholesterol. This is an example of these kinds of new tests. High numbers of small, dense LDL particles could ultimately cause cardiovascular disease, even with a normal total cholesterol. So the lipoprotein particle number is the primary driving force for coronary artery disease. It should be less than 900, and the way to bring it down with nutrients is niacin, B12 folic acid, EGCG or ellagic acid prevents oxidation, but a plant-based diet is the most effective way. Sedentary lifestyle, 60% of Americans don't exercise regularly, 25% don't exercise at all. This is associated with a huge expenditure due to physical inactivity. The human body is designed to move, it's a requirement for health. It was something natural in our history. This was a study published in 2002. Men who ran for an hour or more each week, that's only an hour a week, had a 42% risk reduction compared with men who did not run. An hour a week is not very much. Men who used weights for 30 minutes or more per week had a 23% risk reduction. and so on. Brisk walking, 18% risk reduction. The benefits of exercise for your body, we all know this. Every system is improved with exercise. Oxygenation lowers blood pressure, raises your HDLs or good cholesterol, improves oxygen delivery, helps to reverse atherosclerosis, improves hormone production, metabolism, reduces C-reactive protein, reduces insulin resistance. It's essential for good health. How many people exercise regularly? Good. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? This was a study published in the Archives of Internal Medicine in Europe, 23,000 Germans aged 35 to 65. The 4 factors they looked at were never smoking cigarettes, a body mass lower than 30, which is reduced weight, exercising just 3.5 hours a week, and then eating a healthy diet, which they referred to as fruits, vegetables, whole grain, with low meat consumption. They did these 4 things. They followed them over 8 years. And they found that people with all 4 factors had a nearly 80% lower risk of developing chronic disease, 93% lower risk of developing diabetes, 81% lower risk of developing heart attack, stroke 50%, and cancer 36%. This was another large study on the risk factors for heart attack. They looked at these risk factors in 52 countries in Canada, 30,000 people. They reported it in the Lancet, and they found that cigarette smoking increased the risk for heart attack by 35%, but stress, depression, a feeling of lack of control, was almost as high. High blood pressure 18% and obesity 20%. This is an important study. It was done by Dean Ornish, University of California, San Francisco. He took 28 patients, small number, and another 20. He had the 28 patients in the program. He had them do a low-fat, plant-based diet, no animal products, and he had the other 20 do whatever their doctor recommend, which is statin drugs, high blood pressure, follow the advice of your cardiologist. The people in the program, they did exercise and a low-fat plant-based diet. They had an 8% overall regression of coronary artery disease, while the control group, following the advice of their cardiologist, their atherosclerosis progressed by 38% after 1 year. In the control group, they were nearly complete relief from angina. The example of this is President Clinton, who has a bypass in 2006 and 4 years later needs a stent. His coronary artery disease progressed while he's following the advice of his Cleveland top echelon cardiologist. Now, at the advice of his daughter and T. Colin Campbell and Caldwell Esseltine, he's on a whole food plant-based diet. He's lost 30 to 40 pounds, and he's beginning to reverse his coronary artery disease. Dean Ornish published his work in this book. The other one is Caldwell Esseltine. He argues that conventional cardiology has failed patients by developing treatments that focus only on symptom relief, i.e. stents, angioplasty, and bypass. They don't address the cause. a plant-based oil-free diet. Oil-free means that all of the fat stored in the muscle cells will metabolize out of there over the 2 or 3 months of a low-fat diet. That's the way you get the fat out of the cells, so there's no longer any insulin resistance. If you want it to go more quickly, you exercise. When the muscles are asked to work, then they'll metabolize that fat and use it. He took patients with advanced coronary artery disease. He had some of them in the movie Forks Over Knives. And these people were told, many of them by their cardiologist, that they could no longer do any more bypasses or angioplasty. And most of them were told by their cardiologist they had less than a year to live. Within months of the low-fat plant-based diet, their cholesterol levels, angina symptoms, and blood flow improved dramatically, and 20 years later, they remained free of symptoms, having been told by their cardiologist nothing more could be done. You have less than a year to live. He couldn't get anybody else in his study. The cardiologist wouldn't let anybody else in. They said, okay, take this group. We can't do any more bypasses here, so you can work on these people. After 5 years, the cholesterol fell from 246 to 137. The 17 patients in the study had 49 cardiac events in the years leading up to the study. What that means is they would have chest pain, run to the ER, do I have a heart attack? We're not sure, come in, we'll monitor you. After beginning the eating plan, there were no more cardiac events in the group over a 12-year period of time. This is a very profound improvement. This is not a statistical manipulation. This is a profound effect. And angiograms showed a widening of the coronary arteries and a reversal of the disease. He published it in this book. He was on the cruise lecturing just recently, and now he's has a center in lifestyle medicine at Cleveland Clinic. But I'm sure the bypass procedures are still going strong. And finally, the China study, the most comprehensive study ever undertaken on the relationship between diet and the risk of developing any disease. 2,400 counties, 880 million people, conducted jointly by Cornell, Oxford, and Chinese University over the course of 20 years. Once again, a very substantial study. And they found, what they looked at was Western diseases, coronary artery disease, diabetes, cancers, and they compared it with diet and lifestyle. One of the strongest predictors of Western diseases was cholesterol. Higher the cholesterol, greater the risk for diseases. And they concluded consuming animal-based protein increases blood cholesterol levels. In contrast, plant-based foods contain no cholesterol, help to decrease the amount of cholesterol made by the body. Diets high in animal protein, including casein and cow's milk, are strongly linked to diseases such as heart disease, cancer, and type 2 diabetes. What T. Colin Campbell did is he gave a carcinogen to laboratory animals, it's called aflatoxin, found in peanuts, and these laboratory animals would develop cancer. He would then give them a diet high in protein, and the cancer would increase. He would cut back the protein, the cancer would decrease in activity. He could turn the cancer on and off by the amount of animal protein in the diet.
Doctor, with whey protein, there's all this stuff that's out there on whey protein that has the casein in it. It's being promoted as something healthy. What are your thoughts on whey protein?
It's the casein that is damaging, that is created this effect. Whey protein is an isolate that does not have any evidence of damaging effect and actually increases glutathione. But I'm not so much in favor, like I used to be, of using a whey protein or protein concentrate for a meal. I think it's still best to have a whole grain to release blood sugar slowly over the next 4 to 5 hours. The macrobiotic diet, the Asian diet, the best diet for humanity is to have a whole grain at the center of each meal. I'm not so much recommending this anymore as a way to get protein as opposed to a healthy diet. This is the book of T. Colin Campbell's work, the movie, Forks Over Knives. Here we have these wonderful foods by Mother Nature, grains. So the new 4 food groups that leads to the reversal of the most common medical problem in our society, not only heart disease, but also cancer, is whole grains, beans, vegetables, and fruits. This is a comparison of protein found in steaks. 20% of the calories from protein in a steak, 25% of the calories from protein in beans. 80% of the calories from fat, 5% from fat, no complex carbohydrates, 70% carbohydrates, and you can see the various effects of steak versus beans in cost, in this. People say, well, I don't eat beef, I eat salmon. Well, you can see here, beef is 37% fat, salmon is 40% fat. Chicken 23, tuna 21. And look at the cholesterol. So you're not really making a big difference by letting go of beef and having a slab of salmon. Plant foods have this percentage of calories from fat and, as you know, no cholesterol. Type A behavior is also a factor because the key factor in any disease is consciousness. Everybody's heard of type A behavior. Type A behavior is someone who learns in childhood, I will be loved if I produce. Is the typical hard-driving businessman. Problem is, they enter life with this belief system, but they aren't loved because they produce, and that creates the hostility that we believe is the factor that increases the risk for heart disease. Cortisol is a very important issue. You can see this is from chronic stress. These are the effects of cortisol. Contributes to insulin resistance, heart disease, high blood pressure. This is a very interesting study produced by the Institute of Heart Math where they looked at heart rate variability. Showed that negative emotions lead to increased disorder in the heart's rhythms, whereas positive emotion creates harmony and coherence in the heart rhythms. This is the form of heart rate variability that I have used over the years, where you simply do some breathing exercises. You can see here, this horizontal axis is the parasympathetic nervous system. The vertical axis is the sympathetic nervous system. This is the stress system. This is the long-term healing system that governs blood hormone production, digestion, and immunity. This particular person has had so much stress that just sitting there doing normal breathing, which is the blue dot, they have a -4 on the parasympathetic axis and a +3 on the sympathetic. So they are experiencing stress at a high level just sitting there because they have trained themselves to be stressed. just like an athlete that trains themselves to do some remarkable gymnastic move or high dive maneuver. This is the training. But it's also important to notice that with 3 minutes of deep breathing, they move their parasympathetic nervous system to from a -4 to a -2, but they still have the high sympathetic tone. This is the area where people get sick because they're under stress all the time. This is the Heart Math Institute. Since emotional processes can work faster than the mind, it takes a power stronger than the mind to bend perception, override emotional circuitry, and provide us with intuitive feeling instead. It takes the power of the heart. While most of the adult population reports experiencing personal or emotional problems in the course of a year, about 50% of those people say that they're unable to solve their problems, and about 1/3 state that they're unable to do anything to make their problems more bearable. This is a lot of the research on heart attack. Harvard found that of 1,600 heart attack survivors, found that when subjects became angry during emotional conflict, the risk of subsequent heart attacks was more than double those that remained calm. Men who complain of high anxiety are 6 times more likely than calmer men to suffer heart attack. So once again, consciousness becomes the overriding issue other than the other risk factors. This is a 20-year study at Harvard showing that worry about social conditions, finances, significantly increase the risk of heart disease. An international study of nearly 3,000 reported highest level of personal mastery, feelings of control over their life, had a 60% lower risk of death than those that felt helpless. It goes on and on. This is a study at HeartMath once again showing that the electrical field is 60 times greater in amplitude than brain waves. Oh, hi. Come on in. Yeah, well, we're just about winding up, but you're welcome, certainly. The magnetic component of the heart's field, which is about 5,000 times stronger than that produced by the brain. So the heart has a magnetic energy field that is very substantial. This is a graphic of this field produced by the heart. They believe that the changes in the electromagnetic sound pressure and blood pressure produced by cardiac rhythmic activity are felt by every cell in the body and further support the heart's role as a global internal synchronizing system. This is very impressive research where they had 5 people using techniques to create mind quieting, focusing positive emotions, and this human emotion changed the shape or conformation of the DNA, which was in a glass beaker at a distance. So DNA is, I believe, a sensing device, a sensing system that is listening to the electromagnetic environment and is also listening to thought and emotion. Listening to every thought and every feeling that you have. So this is my book. It's on the psychology of disease, and you're right in time for the conclusion. Anybody have any questions about? Yes.
Could you just make a couple comments on how peripheral arterial disease is related to this subject matter?
The same risk factors that contribute to blockage in the femoral arteries or the carotid arteries or the coronary arteries, they have the same risk factors, but it's highly individualized as to where a person is going to get their blockage. I believe this is another indicator for the consciousness factor. I believe all illness is created by consciousness. The problem is 80% of the mind is unconscious. So why somebody plugs up a femoral artery and gets claudication, and another plugs up a heart artery, this is part of medicine that we're still trying to understand. Others plug up the carotid arteries. Any other questions? Paul?
So there's this big gap between dentists and doctors, and you've got something called periodontal disease, which is an inflammatory and I guess something to do with impurities that are getting into the blood system. So how do we bridge that gap? Because it just seems, I'm in the cardiovascular world and I'm seeing two separate things when we're really talking about the same thing. And the primary care physician doesn't want to spend time talking to the patient about their teeth and gum disease and those types of things, but it's really part of the overall health. So how do you handle that? I mean, do you get referrals from dentists? Are you working with them?
I am working with a dentist right now who's referring patients for the multi-channel cardiogram. It's well known that if you have a source of chronic infection in your mouth, like gum disease, or an infected root canal, or some, bone infection deep underneath a tooth, that source of bacterial infection can seed into the bloodstream and elevate C-reactive protein, which is a protein made by the liver to fight infection. When C-reactive protein goes up, as we said before, it's a marker for inflammation. The blood becomes thicker and it increases the risk for numerous diseases because the blood doesn't flow as well through the microcirculation, the capillaries, and it reduces oxygen delivery, and the blood is more prone to clotting. The C-reactive protein can't fight the infection, participate in a healthy inflammatory response and get rid of it because the infection is persistent in a dental area. Dr. Issels, a German doctor who was the first to treat cancer using holistic approach, he had a dentist in his clinic in Germany, and he would remove any root canal teeth first thing before they started holistic cancer therapy, because it can definitely contribute to chronic inflammatory conditions within the body. Elevated C-reactive protein is a marker for the terrain of the body being susceptible to cancer cell activity. If somebody has had successful cancer treatment, you follow the C-reactive protein, hemoglobin A1C, and other things to see if they're reducing the tendency for cancer cells to grow. But there's a very simple treatment that Vesna brought my attention to. It's research done in the Ukraine by an oncologist where you use sunflower oil and you pull it between the teeth. It's called oil pulling. Organic sunflower. The website is oilpulling.com, and it will pull infection out of the teeth. You can also, but you have to do it every day. You can also apply lasers to some of these infected teeth, and we've been using pulse magnetic field therapy as well. But it is true. Some people say that the health of your body is strongly reflected by the health of your teeth. Chronic infection should be eliminated.
Do you have any thoughts about autoimmunity and how that relates to inflammation? Because a lot of these autoimmune diseases are inflammatory processes, like arthritis, lupus, thyroiditis. They're all autoimmune and they're all inflammatory.
One of the biggest things to think of, especially with Hashimoto's or autoimmune disease for the thyroid, where they have elevated thyroid peroxidase and thyroglobulin antibodies, is gluten intolerance in the bowel.
Oh, okay.
Yeah, if anybody with Hashimoto's, you have to rule out gluten intolerance.
Okay.
When somebody has a genetic inability to digest gluten, gluten then becomes a toxin in the lining of the small bowel, and it will eventually damage the cilia in the small bowel and produce atrophy over years and years and years, leading to disease, which is diarrhea and malabsorption. Well, that exposure of intracellular contents allows the immune system, we think, to see intracellular anatomy and cellular structure, and then the immune system will make antibodies. Once that inflammation is occurring in the bowel and autoimmunity starts in the lining of the bowel, it can spread to other parts of the body. People with gluten intolerance have a higher risk of thyroid disease, diabetes, lupus, rheumatoid arthritis, and other autoimmune diseases. Also, there's a book from Johns Hopkins called The Autoimmune Epidemic, and they believe that chemicals and heavy metals distort cellular structure, creating an abnormal cell configuration, allowing the immune system to make an antibody. And finally, women have 9 times more autoimmunity than men, so we think estrogen has playing some factor. So with autoimmunity, you need to make sure it doesn't progress. The 2 things you can do to prevent it are optimizing DHEA and optimizing vitamin D, and then eliminating or evaluating for gluten intolerance and detoxifying. Yes?
What about consciousness?
Autoimmunity, yeah, that's the good question, because that's the next.
Yeah, well,
I didn't hear that. What was that?
What about consciousness?
Yeah, what is that consciousness that would cause you to have your body attack itself?
well, as complex as the body wisdom is, the relationship between consciousness and the body is very metaphorical. People with low back pain do not feel supported in their life, either financially or emotionally. You can track it back to childhood when they weren't supported. People with shoulder pain feel burdened. People with digestive issues cannot digest what's going on in their life. Autoimmunity, if people are attacking themselves, if what they do is not okay, you know. See, the key ingredient for long-term health is called self-love. I'm creating my life experience through consciousness. If I create a life experience and then I reject it or complain about it, it creates this fundamental conflict that will eventually produce either mental or even physical disease. If I don't like myself, that's like a fundamental conflict that's going to lead to all kinds of psychological and eventually physical problems. There's a book called Feelings Buried Alive Never Die by Carol Truman, Carol with a K. And you can look up rheumatoid arthritis, lupus, and other diseases and find an emotional issue. With rheumatoid arthritis, I know it has to do with a lot of anger, but it's not being expressed. See, anger is a beautiful emotion. Anger says, this is not okay for me. If a child could express anger, they wouldn't be abused. If they could say, this is a boundary, you can't do this to me, then anger is protective. Some people don't think it's okay to be angry because that's a dysfunctional, they believe, they learned in childhood. So expressing and releasing anger is a healthy expression of feeling. Holding on to anger, ruminating on it, thinking about it, creates chronic inflammation that can become lupus or rheumatoid arthritis. Yes? Huh?
Not just
Expressing anger in a responsible manner. I ask people, I asked people, how many people is it okay to get angry?
It's really hard. I mean, I think as women, sometimes we're brought up that you don't express anger. I think
Can't
men
get-
generally tend to be able to express it easier.
You have.
Maybe I'm being.
What?
It really makes me mad that I can't.
Right.
I've heard all kinds of reasons. People will say, if I expressed anger, I might kill somebody. You know, I might knock somebody's head off.